What's up everyone, Daily Dose here. So in today's video, we're going to be discussing meth detox and withdrawal, as well as just some common knowledge and questions that patients sometimes ask me / just anyone who works in the psych setting, and in particular the inpatient setting. So let's just go ahead and jump right on into this and talk about the meth detox and how I see this and how we treat this in a inpatient psych setting. So if a patient comes in and they are actively on meth, sometimes this will happen. They typically will put them first on more of if they have to, like a high acuity unit if there's any psychosis. But typically you will be able to see what I see as well as a lot of times that patients, when they first come in, tend to be more violent if they've been injecting it. When somebody is injecting methamphetamine, it is a whole different ballparking game in regards to psychosis and just the detox in general. And I'm not saying that that doesn't justify you to just be able to be like, oh, well, I just smoke it or snort it or booty bump it. Very common. People will try to bring it into the psych facility that way by booty bumping. But anyway, I go off topic. But if they smoke it compared to shooting it, I will say the withdrawal is a little bit easier for that person, because when you are injecting, man, your brain and cognitive abilities, a lot of times in those neural pathways you have created and changed your brain that much, a lot of times the withdrawal can be a lot longer. Now and that's more I'm talking more mental withdrawal in that way. Now let's just jump right back into in the psych setting when they come in. And let's say their last use was 24 hours ago. So after their first 24 hours, how will they present? So on average, once again, let's say they're not shooting this time. The big thing is they will have a crash. And a lot of times for people who are using meth, you got to understand that there are times, and this is either shooting it, smoking it, whatever way, you'll be up for days, sometimes even a week, and you haven't slept, and then they come into the psych setting and they can present just more psychotic symptoms at first, but then transition from there to a crash. And sometimes we try to have this crash happen, push the crash to happen a little bit faster. So if they're coming in and they're psychotic, a lot of times we will give them a shot of either an antipsychotic like Zyprexa, or if they just need to go, if they really need sleep, we'll typically like Haldol, Benadryl, Ativan, a B52 is what they call it, but it's Benadryl 50, Haldol 5, Ativan 2. A lot of times if you get that, they will go to sleep, and then they will be asleep for at least 24 hours. There are times where people, when they crash, they will crash for literally 2 days straight. But the crash typically is the next big period in regards to when they come in. What we're trying to get them to is just sleep, because a lot of times that's what they need. Now, outside of that, I'm not going to say the good thing, but one thing that's very interesting about methamphetamine use, it's very hard to overdose on solely alone without using anything else. But at the same time, it can create a lot more just dangerous. You have a lot like medical / chronic conditions. So you've had a lot of bone thinning, lost a lot of strength. It goes on and on. But compared to something like alcohol, you don't need to give them a benzo because they could have seizures. The reduction while you're detoxing, the detox can actually be a little bit safer cold turkeyed. A lot of times assistance isn't needed if you can just if they can just go right to sleep. But yes, sleep is huge. Also, what I want to talk about is a lot of times once they come off of meth, sleep can still be a problem. Nightmares can, trazodone, prazosin, things like that really help for sleep, just in general. So that's something they'll use post using. But once again, let's real quick go back to the detox. I don't do any editing in these guys. I just talk about what my experience is. And yes, you are correct. I will say this again. I've never used methamphetamine, but working in a working in an inpatient setting, in a psych setting, methamphetamine use is increasing. It's a very cheap drug, very accessible drug, and it ruins lives. I will just be real honest and frank, because this next quick part I'm just going to talk about is the family atmosphere in regards to a lot of times these people using. And here's the scary thing. There's no divide. It can be somebody who comes from a great family. It can be somebody who comes from an impoverished family. That's just how drug addiction is. It's, in my opinion, it is something that you can, not going to say inherit, but I feel like there are genes that can be turned on if you've been exposed to trauma as a young kid, and just having a family history in itself can really play an impact. And a lot of times, in particular with methamphetamine, if a parent is using and a kid is seeing it, being exposed to it, there's a lot higher chance of them using. But from what I've seen, outside of that factor of parents use, they were around it when they were younger, that does play a huge impact. But another key point to this is with the access today to a lot more stimulants to the younger generation, if for whatever reason, they can't get their script anymore and they've been on stimulants their whole life, what happens is, and I've seen this as well, is they go to meth because they're trying to focus and stay on track because they have severe, not even going to say ADD, ADHD, but just things like this. So if they've been on something their whole life, sometimes that can play a role in somebody using meth. I will say it's fairly uncommon for somebody to just use meth. Like, it's like, the first time they've ever used drugs, they use meth. Typically, that is not common at all, in my opinion. There's specific populations where it can be more, where it can happen, but in general, no. Also, once again, I know this video has been everywhere, but just kind of my thoughts and from what I've seen in regards to this. A lot of times, I'll just say, a lot of times when I first started in psych, I never thought I would see how a drug and just drug addiction in general, how it could go down that violently, that somebody goes into psychosis, or even more scary, somebody, inherently has a predisposition to psychosis and they use meth and then they're in psychosis and they have to use antipsychotics the rest of their life. These are very real things. So I want to be very serious when I talk about this. I've now worked in an inpatient psychiatric setting for 4.5, 5 years, different settings, still do to this day. And for me, that is still one of the hardest things to see, is somebody who is, it can be drug induced or just psychosis in general, seeing somebody in psychosis. You got to understand that when a lot of times it's drug induced, and with psychosis, once again, meth, they're a lot of times completely different. But the thing I'll say is I'm very blessed and thankful to work in a psych setting, because I get to help people, and I get to see when people leave the setting a lot of times be in a lot better state than they were when they first came in. And I know there are a lot of people who complain online and say psych settings are horrible, this, that, and the other. Look, I understand where you're coming from, but you got to understand, yes, a lot of the settings can, it's not that they're bad, but they don't help the individual who's in the psychiatric setting. It doesn't help them. Sometimes it can traumatize them more. A lot of people who work in psych, who have been in it for a long time, you can tell they care, because why else would they be working in it? But I'll tell you this, to summarize this video, and just in this video in general about meth, if you need help, you can get help. If you need to go to a psychiatric setting and get the help you need. Don't let people let people judge you. You got to understand that I've seen it where people go into the psychiatric setting for a week. How if they wouldn't have went in, more than likely they would be in a lot worse place than when they left. A lot of times when they're in the setting, it shows them, and shows around them just other people are suffering, and it really helps pull that individual up to want to be better and want to quit using methamphetamine, or if it's whatever drugs. That's why I work in the field, and why I talk about mental health in general. It's just because I love helping people as well. The next video we'll be talking about is I'll probably do another 60 days in, and also I'm going to do an update on my running in general. And I'm running every day, doing a lot more outdoor running and stuff, but just be on the lookout for that. I love you all. Thank you to all the new subscribers. Like and subscribe, leave a comment, do what you got to do. Just don't hate me, don't be a hater in the comments. Get ready for the next video. I'll be dropping it soon, either a 60 days in reaction, or once again, just an update on running. Check out my running blog as well. Check out that playlist, 365 days of running every day for a year. Love you all. Have a great week.